Okay, thanks for joining, everybody. We'll go ahead and get started. On today's agenda, we're going to go over the PO scorecard for the next year. So you may recall at our May PO call meeting, Mark Cohen joined from Blue Cross Blue Shield and talked through a little bit about that and their philosophy with that. He should be joining today as well. It doesn't look like he's on yet, but may be able to answer any additional questions you have that I can't answer. But we'll go through the specific criteria and talk about what that will look like. We also have the proposed year 3 VBR that's going to be starting on September 1st. So we'll talk through the measures for that and what that looks like. And then we just have some brief announcements and reminders on the CGM user experience program we're rolling out, our July patient advisory board, the dashboard updates, and PO quarterly reporting for the data. So as a reminder, we have the PO scorecards that we're going to be putting in place that begin along with the same PCP VBR schedule of September 1st to like June 1st of next year. So Blue Cross asked MCT2D and all the other population health CQIs, so Inhale, My Mind, My Back, to implement PO scorecards to tie to the annual funding that you receive for participation in the program. So that's the $75,000 payment that you're earning as part of MCT2D. There's also the additional payments for recruitment and the $10 per type 2 diabetes patients from Blue Cross Blue Shield or BCN within your participating practices. The only one that this is tied to is the annual $75,000 payment. The initial payments for this cycle will be distributed in January 2025. So what we'll be doing is much like we put out a yearly VBR, like we'll have this yearly scorecard. It will likely change as the program changes, with some things remaining consistent. Same with the VBR. So for example, we always have the regional meetings as part of the VBR thing. There will be certain components that we always have on this scorecard too. And each element of the scorecard is weighted. It's going to total 100 points, and your payment will reflect how many of those scorecards objectives you achieve and the respective weight of those objectives. So it's going to take the $75,000, and if you received 90 points, you'll receive 90% of that $75,000. If you receive 100 points, you receive all 75,000. So to go into how we've broken this down, and please jump in at any time with questions, either in the chat or unmute yourself. I want to make sure everyone understands, and we'll also be sending this out to you as well, and you'll have additional time for questions too. So we've split our 100 points into these 4 different sections: meeting attendance, data, maintaining contacts on our administrative portal so that we always have someone to reach out to, and engagement. So I'm going to go through each of these 4 categories individually. So for meeting attendance, we have these 4 meetings that you've been attending and that we've asked you to attend for the most part since the start of the program. So we have these PO monthly calls that you're on right now. So attending 7 out of 9 of these calls will be worth 5 points. So we don't have them in the months with regional meetings and collaborative wide meetings. So we never have them in April, June, or October. So that's where the 9 comes from instead of 12. And then if meetings are just canceled because we don't have content or don't have things to go through, we'll of course adjust what the number that has to be attended is. And then just 1 participant per PO is required. So if you're the admin lead or PO primary contact and you typically attend, but you're on vacation and the PO clinical champion steps in, that counts for your PO's attendance for that month. And we'll be tracking it on our end, and we'll keep this updated for you on the administrative portal as well. That's another thing I should have mentioned at the beginning of this. Much like you have the VBR metrics on your PO, your administrative portal right now, we're building out the scorecard on the administrative portal too. So throughout the year, you'll be able to see like, okay, it's March, I've attended 3 of these 9 calls so far. We just have to attend 4 more to like meet this requirement, and it'll auto update similar to how we did the VBR metrics. So you'll be able to see this here, know how you're doing in these here, etc. The second one is not going to make as much sense until I go over the VBR, but so I'm going to circle back to this and talk about it once we look at the VBR. But essentially, we're going to be asking you to choose one of the MCT2D quality initiatives to particularly focus on in this next VBR year. And then we're going to be hosting a meeting on the medications with all the POs who chose to work on that, a meeting on CGMs with all the POs who chose to work on that, and a meeting on low carb diet. So just attending that and being a part of that meeting and participating will meet that second requirement. So I guess I fairly well explained that, considering we didn't have the full background on it. More to come on this later in the presentation. We have the PO one-on-one calls that we implemented beginning later today actually, and then going out all through next June too. So attending that 1 hour call with one of the representatives from your PO and just speaking with us, answering our questions meets that requirement. That one's 10 points. And then attending the collaborative wide meeting with an administrative lead and a clinical champion from the physician organization attending. And much like with the regional meetings, this is definitely something we'll allow for substitution on, especially I understand our collaborative wide meetings in June, people may be on vacation. So if a PO primary contact attends instead of the administrative lead, we're going to count that. And if your clinical champion can't attend, but you have the admin lead and a primary contact attend, that works too. So we will be flexible with that as well to account for people being out of the office. Any questions at all on the meeting attendance piece before we move on to the other sections? Okay. The next one is going to be data. So this part's a little bit slightly more confusing. I'll try to talk through it in detail and again, answer any questions that you have. So we've been working on the data and enhancing the completeness of that and ensuring we have the same fields, et cetera, as you know, just working on like data quality type measures within the PPQC data. So two of these elements are very related. It's ensuring completeness of the data for BMI, ensuring completeness of the data for A1C. So what we did, and this is all information that we're going to share with you in the administrative portal as well, so you know exactly where you are with your current submission rates and what we're expecting you to try to increase it to. And we do want this to be a conversation. We've made what we thought was reasonable expectations on this, but if for any reason there's challenges that we are not aware of that will make this impossible, we want to have a discussion with you. But we looked at the submission rates of both BMI and A1C and the PPQC data. You can see here the median submission rate across all of the POs was 82%. So that meant 82% of the time the BMI field was filled out. For A1C, it was 56% of the time that it was filled out. And so what we're asking is based on where you currently are, so it'll be an individual level goal per PO essentially based on your current submission rate, is to just increase your submission rate to reach like the next quartile before the end of this like performance year. So like within that 9 months. So the quartiles on the BMI, the lowest is 69%, the median is 82%, and the upper is 88%. If you're already in the upper quartile, we're just asking that you maintain your submission rate. There's not a required amount that you have to increase it to. Same goes for A1C, except that the submission rates are a little lower. So the lower quartile is 50%, the median is 56%, and the upper is 78%. So like I said, when we share this scorecard information in the administrative portal, it'll say like right now your submission rate is X%, your goal submission rate is 69%, let's say, if you're in the lowest quartile. So that's what that'll look like. We'll continue to communicate with this with you throughout the year. As we get the data refreshes, we'll update what your current rate is so you can see if you're making progress along that goal. And we'll show like your previous ones as well. So hopefully we'll be able to provide information on this that makes it clear like where you're standing, what the goals are on it as well. And we can have a discussion about that. The last one is going to be submitting additional data elements as requested. So for example, we've talked about things like submitting serum creatinine or submitting unit measures along with weight, since right now we're getting kilograms, pounds, ounces without necessarily being able to determine which is which. So we'll be asking you to submit those. And if there is a reason that you cannot send that or develop a plan to include it in the near future, for example, maybe your EMR system that you're using just has absolutely no way to do this for whatever reason, we would then ask you in lieu of doing it to submit like an explanation to us what the barriers of submitting, and you still get those points. We're not going to hold you accountable for something that you legitimately cannot change. So it'll just be more the notification process and telling us about that. Questions on this portion before we move on? Great. So next we have maintaining contacts. So I'm going to talk about measure 8 and 10 first, and then go back to measure 9 since these two are very similar. So essentially, this is just ensuring that you have these contacts identified and listed in the administrative portal. So that you always have an administrative lead in place, you always have a clinical champion, you always have a data contact. We've called that a quality assurance role, but I feel like data contact is a little bit more specific as to what we've been using that for. So basically just having those roles defined, and if that information is missing or we receive an email bounce back like someone has left the organization, we'll notify you, and then you'll have a month or so to identify a replacement like for that role, or a temporary replacement as you're doing like a more extensive search. But essentially maintaining physician organization contacts, and the same at the practice level. So ensuring that the clinical champion role and the practice liaison role are identified and listed in the admin portal, and that contact information is kept current and complete, and same will notify you if we're seeing that it's not. So one of the new requirements that we're implementing as part of this scorecard is we've taken a look at like the clinical champions, and we thought that it would be the most useful for quality improvement and the work that we're trying to accomplish within the practices to have a separate clinical champion for each practice instead of having one person fill a role for multiple practices. So essentially just a one-to-one relationship between an individual practice as we have designated in our administrative portal, and the way that we come up with like what constitutes practices from Blue Cross's practice unit list. So if Blue Cross is looking at something as an individual practice unit, that's how we look at it as well, as an individual practice unit. So designating one person for each of those and not having one person be over 3 or 4 practices, for example. And so that'll be associated with 10 points on the scale. Questions on this before we move on? Okay, great. And so the final section is engagement, and this section is going to be the most aligned with like our BBR metrics. It's like, for example, you'll see on measure 12, meeting the PO level learning community requirement. It counts on the VBR, and to kind of align incentives and the work that's being done, we also have a count on the your PO scorecard as well. So when you meet it, it's going to be met on both the VBR side and the PO scorecard side. The other ones we have here is communicating with practices on regional meeting attendance. So basically monitoring practice level clinical champion registration status. So we'll have that information available for you in the portal, and proactively reaching out to ones who haven't registered for the meeting as we get closer to it, or ensuring like a substitute attendee is registered and attends the meeting. So considering it met if all clinical champions or substitutes for them are registered for the meeting 2 weeks prior to the date, and that we're informed by you if a practice isn't going to be sending someone, either their clinical champion or a replacement. And then this you'll be familiar with from our current VBR. It's just meeting the PO level learning community requirement. And we've listed out the activities that currently meet it here. And then finally, this is related to the VBR that we're going to go over next. So essentially supporting practices in their quality improvement work on a medication prescribing low carb diet or CGM. So like I kind of alluded to, we're going to have you choose one to work on, and then there's associated VBR requirement that I'll go over. I'll go over that in the VBR section, but like I said, it's just to align incentives so that when it's met there, you're also receiving credit for it in your scorecard too.
Hey, Jackie.
Yes.
This is Mark Cohen. How you doing? Real quick, on measure number 11, I think I want to make a little slight change to that. So it's a little, because the criteria, the real metric is regional meeting attendance, right? Not necessarily the communication. It's the actual, it's the regional meeting attendance.
Well, to differentiate, and Eric, I see you had a question about it in the chat. So how is it different from the earlier measures of meeting attendance? We're not requiring the POs to attend the regional meetings, though most do choose to send a representative to it. We do require the practice level clinical champions to attend. So it's more supporting their attendance on it and making sure they're registered. Our team's done a lot of follow-up, like with clinical champions, trying to get them registered and make sure that we have people registered in time. And we want the POs to take a more active role in that, if that makes sense.
So it is around communication.
Yes, so that's why I have it'll be met if all the clinical champions and substitutes are registered 2 weeks prior, and we're informed if they're not going to be sending someone. So basically 2 weeks before any meeting, we either we know all the attendees and we know who's not going to be attending.
Okay. I want to make sure that's clear to everybody on the call too.
Okay.
That's the criteria and that's the expectation.
Okay, thanks, Mike.
Yep.
Any other questions on this or on the PO scorecard at all before we move on? And Mark, are we good to send out the scorecard now to everyone? I think we're fully approved on your side. Is there any reason I can't send it out after this meeting?
I don't think so. Let me just talk to the field team real quick and then I'll get back to you. I don't think so. The one question I think that they had when I talked to them last week was some clarification around this measure 11, just to make sure it's clear to everybody that it's either the communication or the regional meeting intent. It's just clear what specifically the ask is. Is it that they attend or is it that they communicate? Because here, where it's saying the metric will be considered met if they're registered versus if it's communicated to you in a way that it's registered, or you're saying that it's met if MCT2D is aware of kind of aware of the registration. I want to make sure it's clear to everybody that was one question I got from the field team.
My concern is to hold the POs. I don't want to hold the POs accountable for something that they aren't in control of. So sure. I feel like if they have everyone registered and someone doesn't attend a meeting, it's not really the fault of the PO and they can't necessarily control it or know that it's happening. So I didn't feel like that was fair. And we hold accountability for attending those meetings at the practice level. So it is a practice level VBR metric. And we have a strike system where they can only miss so many of them as well. So I felt like we had that accounted for elsewhere. And we didn't need to necessarily ding the POs for that. I felt like it wasn't fair to do.
I think, and I agree. I just want to make sure that's clear there, that people on the call understand that. And if there's any question about that we, I think address it here with the POs. That was really, I'm fine with the measure itself. It's just, is it clear to everybody what their expectation is?
Thanks. Okay, any remaining questions on the scorecard? I'm responding to the one in the chat now. Are there others? Okay, great. We will switch over to talking about the year 3 PCP VBR next. So that's going to have the same timeline that we've had for this last VBR cycle, where it begins on September 1st and it goes through June 1st, because that's the date we need to get the names of the people who met the VBR to Blue Cross Blue Shield, since this is a prospective payment. And if they don't meet this previous year's, Blue Cross isn't going to prospectively pay them for the next year. That's where the 6/1 deadline comes from. And like we talked about in the past, these summer events that are kind of in no cycle, they're going to be counting towards your 9/1 VBR. So for example, 2 weeks from now, we have our learning community talk on metabolic surgery and type 2 diabetes. Anyone who attends that is going to start on September 1st with their physician level learning community requirement already met. And same with any other work that's going on over the summer. If your PCPs have done a survey on the tool feedback or have met this in any other way, it's going to be captured and we're going to count for that. Okay, let's go on to this year's this year's VBR requirements. So these first two are going to be the exact same things you've seen in the past few years. We're continuing on with the learning community requirement. So doing the physician level, the practice level, and the PO level. One thing our team is trying to do for this year is offering more practice level options. That's the one area where we felt like there could be more ways for them to meet this, just so that your practices have like a really good kind of menu of options to pick from. So we're thinking about ways that we can expand that one. The physician level ones with the learning community events, we feel like have been working really, really well. Those are well attended and well watched in the recorded versions too on YouTube. So we think those have been helpful, especially with the topics coming directly from the participating sites of what they want. That's likely something we'll continue, and we'll use the fall meetings to generate ideas for that. For the practice level one, we want to expand a bit, and when there are opportunities throughout the year of different things, we'll likely add on additional ways that these can be met, and we'll update our learning community PDF and website with all the opportunities that are kind of easily clickable and reachable from there too. And then we have the attending the spring and fall regional meetings. And then now this next part is where it's going to be really a shift from what we've been doing in the past. So this is going to be the year 3 VBR for both cohort 1 and cohort 2. We're going to be shifting everyone to the same approach, and likely when we recruit again in 2024, it's going to be, instead of cohort 1, cohort 2, cohort 3 VBR, it's going to be kind of ongoing in MCT2D VBR and new to MCT2D. And we'll have that initial year always be a ramp up year where they're doing training, where they're getting oriented with the work and just getting more familiar with it. And then anyone who's going to be in that second year is going to have more process measure goals moving forward. So that's just simplify things a little bit, because if you have sites in previously both cohorts, they're all just going to be on one thing now. Secondly, in the past, it's been more things like surveys, submitting a best practice, giving updates on how you've made changes in your practice, etc. We're going to be shifting, and it's been more at a practice level. We're going to be shifting more to work that you at the PO are administratively managing and conducting and supporting your practices in, and it's going to be less of like giving updates, completing surveys at the practice level. So beyond the things I just showed you of the learning community and the regional meeting attendance, there's really one other main VBR measure. And so what you as a PO are going to do is you're going to choose low carb diet, medications, or CGMs as your main focus for this next year of VBR. And then all of the practices in your PO are going to be working on that same measure. So you're going to pick low carb diet for every practice in your PO. You're going to pick CGMs for every practice in your PO. And then we've come up with what we would like to ask you to do over this next year. And I know there are a lot of words on this, and we're going to send these slides out like we always do and have the recording as well, so you can refer back to it. So the medications and the CGM options are going to be almost the exact same, because those are both things that we get from the claims data. And so the approach to those measures are going to be very similar. I'll go over one in detail. Low carb diet's a little bit different because we don't have any data within the dashboards that we can reference for low carb diet. So we're going to be approaching this using patient reported outcomes. So let me walk through how we'd operationalize the low carb one if you chose that. So any PO that's choosing this, we're going to ask to distribute and review patient reported outcomes to develop an action plan for addressing like low carb diet education and support from the practices. Then we're going to be asking you to implement like an action plan based on that and then report out on it. So it'll be met not by meeting a specific goal, a specific number of pros, but by doing the process level work related to it. So having a meeting, submitting an action plan, attending like the PO level meeting that we'll have on low carb diet, et cetera. So that's why it's a process measure and not a performance measure. So for sites that choose low carb diet, we'd ask you to distribute patient reported outcomes at your practices to patients with type 2 diabetes, not necessarily those that have been put on a low carb diet, just any patient with type 2 diabetes between October 2023 and January 2024. We have like funding to support them completing these pros, so there's an incentive for the patients, and we'll work with each PO who chooses low carb diet to come up with a reasonable target number of pros. We don't just want to set an amount overall and then have a PO that only has a few practices enrolled trying to capture as many as a PO with 20 practices enrolled, for example. So we will work with you on that. Then based on what we find in this pros data, and we'll be working on developing these pros, and we'll also include you in the development process, the POs that choose this, and make sure we're asking the questions that you want us to ask that will be helpful to you. And based on that, we're going to be developing an action plan with you to implement around lower carbohydrate diet support and education to deploy by February 2024. So examples of what kind of things we thought you could come up with as an action plan, and these are just examples. It would be whatever makes the most sense for your PO. Like maybe what you find out from the pros is that they don't have your patients don't know what to do when going out to eat on a low carb diet, or they struggle when they go to family events and etc. So maybe you create a packet of low carb diet resources that we will create and like address gaps in if we don't already have a resource for it that addresses these challenges that your patients identified. So, and then you distribute that to patients that you put on a low carb diet, for example. You could deploy we're working right now on an introduction to low carb video series. So maybe you come up with a way to systematically deploy that to patients that you're recommending a low carb diet to. Or maybe finally you decide to set up specific follow-up intervals for outreach to patients that you prescribed a low carb diet to do check-ins with them. These are all just different ideas and options of things that you could do. And the action plan would ideally be based on the information that we determine from these pros responses. So then the next step would be collecting additional pros from patients who have been put on a low carb diet, like the same survey between March and May 2024 to evaluate the success of the implemented change. So for example, to go back to the one I gave here about creating a packet of low carb diet resources, let's say, like I said, the main struggle identified from your patients in the pros is like going out to eat or family and friends events. Like if that was the thing you wanted to address and then you gave resources around that, these next pros would be seeing like if your score changed around those, or if those are now like things that have been addressed and your patients feel more capable in those situations. So ideally we would link it to the pros. Then we would ask you to be submitting like a very brief reflection on like the implemented changes and like if they were successful or not. And also at some point throughout this intervention, likely in January to February, we, MCT2D, would be working with you all to convene a meeting for all the POs that are working on the low carb diet and have chosen that to just meet and talk about progress and challenges, and we'll facilitate that meeting, including the setup of it. So to recap, this is at like the PO level. We're not asking for any individual like practice level work like these kind of, well, besides the fact that they are going to be making these changes in the practices and working with you as the PO, but it's going to be a one PO level action plan, one PO level submission of like reflected changes and progress, etc. So all this is at the PO level, and then your practices are doing like the work and support on it to make the changes that you've identified that they need to make. Questions? Okay. Okay, looks like there's on the chat. So we're still developing the pros, Erica. We're hoping to just get a really strong start on it right now in like July and August, and start determining like the kind of questions that we would include on that. And then, like I mentioned, it would be nice to get the input of the POs who do choose this one as well, so that we can make sure we're asking questions that are supporting like your goals and things. Yeah, it would be a survey to give to the patients. Yep. Mm-hmm. Any other questions on this one? Okay, great. I will, yes, so it is at the PO level. So it's at the PO level, like in that you're choosing one of these 3 initiatives for all of your participating practices to work on. And then you as the PO are like meeting with your clinical champions, either together, separately, whatever works for you. We're not really saying a specific way that needs to happen, for example, and then coming up with a plan that you're going to implement across your practices. And then, like I said, like the things that you're submitting in order to earn the VBR, it's going to be like 1 per PO. So you'd be reporting kind of on behalf of all of your practices, but your practices aren't going to have individual reporting requirements. Does that make sense? Okay, I'm going to go over just one of these in detail, the medication and the CGM, because really the only thing that's different in the approach is just which of these you're focusing on. They're going to be operationalized the same as far as the requirements. And I'll try to go quickly because I know we're cutting into Inhale's time. So I'm sorry, Sean and Carla. The medications option and the CGM option are going to be very similar. So it's going to be reviewing the prescribing rates of either the medications or CGM over time and developing an improvement plan. And like with the last one, the VBR requirements could be met by submitting the goal, the plan changes, and the lessons learned, not hitting the target that you set in the goal. So we're going to be beginning to distribute quarterly reports to you in addition to the dashboard reporting. The first one's going to be sometime in July. We're working on that now. Then we're going to send one in September and so on. That just gives trending rates and information over time. We have a slide on that later too, with just more detail about that. So based on these reports and the information in the dashboard, we're going to ask you to determine a PO level goal for medication prescribing and submit the goal to us. So like I said, you're not going to be judged on meeting this goal or not. We just want you to look at it and reflect on it and determine, like, okay, here's a gap. We prescribe GLP-1s at like a much lower rate than the rest of the POs. We're ranked 27th to 28th. We think we can go from this percent to this percent. And then you're not going to be judged on if you hit that percent, but just by doing these additional steps. Or maybe you say, like, we have a lot of patients on insulin. We want to reduce the number of patients who are on this and then increase the number who are on either an SGLT2 or GLP-1. We can work with you on the goal and provide support for you in identifying as well. So we're going to ask you to submit that goal. We're going to ask you to meet with the clinical champions twice in the VBR cycle. So an initial meeting that discusses, like, you share the goal with them. You talked about the practice level changes. You submit to us the changes that your practices overall are going to be doing to try to implement this. We're going to ask for this to happen sometime between September and November, and we'll likely have that goal due to us by end of November. The data that you'll be able to look at will be through the end of June. Then we're asking you to check-in meeting with reviewing updated data with the practices and identifying if progress has been made, identifying barriers that still remain, etc. With this meeting, you'd be submitting a report to us on challenges or lessons learned. We're asking that this occur April to the end of May, and the data from that point will be available through the end of January. And then similar to the low carb one, we're going to be hosting a meeting like for each of these 3 separate initiatives with the other POs that have chosen it to just share ideas, learn from each other, see the support that could be provided. So a couple questions in the chat. You have a bi-monthly clinical champion meeting. If you do it in that time slot, is the meeting requirement met? Yes. So it doesn't need to be a completely separate meeting. If you are meeting with your clinical champions on a regular basis, we would just ask that you discuss this and then submit like the process changes and the other information that we're asking you to discuss at that meeting afterwards. And Eric asked, how will you account prescribing data to include meds prescribed or obtained via like patient assistance programs? That's a good question, Erica. We would have to, since it's not accounted for in the dashboard or in the claims data, I don't know. Let me take that back and we can think about it. I don't know if we're going to be able to in any way that like accounts for it. And because too, it's kind of your own goal. I don't know, like, do you guys track that at your practice level? Like, do you know? Because what you could do is track it independently. We won't require you to track it independently, but you could say, like, we'd tracked this and we saw that it went up by X amount, but I'm not sure our ability to account for it, like, because of that. So we'll take that back and discuss it. As far as carve outs, unfortunately, like, we aren't going to be able to account for that either because we just don't get the carve out data. So the information that we're giving to you to set your goal off of already takes carve outs out of account because we just don't have that data. So it'll just be the goal that you're set. It's not accounting for carve outs. And so then any change you make on it isn't accounting for carve outs either. Mm-hmm. Okay. Yep, that is fair. I understand it's gonna be hard to come up with a goal without that data. So the challenge is those we try to ramp up our data things, but not perfect. And that's why we're not at this point holding you accountable to meeting specific goals. Like, we just want to kind of get more deeper into process metrics and working on these specific QI than we have in the past. Okay, cool. Any other questions at the moment about the VBR? Okay, we'll send this out that has all the details. Like I said, I'm going to skip the CGM one for now because it's exactly the same as the medications one, just with like CGMs being the focus instead of meds. I will really, really briefly go through these last few things. One thing, and we're going to receive more information about this later this week, but we're expanding our CGM user experience program. Remember previously we gave this out to the practice clinical champions where they could wear a CGM themselves. We're going to be expanding this to any provider in a participating practice. So any prescribing provider, physicians, nurse practitioners, and physician's assistants who want to wear a CGM, will be providing one for them at no cost to wear. We're going to be emailing the clinical champions this week about that. We don't have like the contacts for all of the physicians or all of the APPs at our participating practices, so we're going to ask and rely on the practice clinical champions to disseminate that. The steps that are included here, and we'll send out these slides. I won't go through them in details, but they'll sign up to receive it. They do have to view a training video. That's a requirement for off-label use of the CGM. And once they do that, we're going to send you one and then or send anyone who's interested one, and then ask them to give feedback about it to us. Really briefly, otherwise, we have a July Patient Advisory Board meeting coming up. We're going to be reviewing our MCT2D mission statement. We've come up with a specific badge for them like we've done for the different regions in MCT2D, just to make them feel included and like their own important part of the collaborative. So we're going to be sharing that with them. We're going to be looking at the patient-facing page on our website and talking about potentially having member profiles. We're going to talk about the changes that we've made to the patient-facing tools based on their feedback. We want to be able to go back and tell them the differences in what we did, and like that we're taking their feedback into account. And then we're going to be talking about in-person meeting attendance. So we're going to talk to them about the collaborative-wide meeting and share the presentation, and have Keith speak a bit about what he spoke about as the patient advisory board at that. Talk about financial compensation for meetings and discuss attendance at the fall regional meetings. And just as a very brief reminder, the changes that were in the June dashboard update, which came out the 19th, right after the collaborative-wide meeting, we added Blue Care Network claims to the data and clinical data as well. So that increased the number of patients in the dashboard. If you haven't looked at it since the June update, you're gonna see really different information now, since we added about 28%, I think, more patients with adding in the BCN data. And the bucketing on the A1C was changed to make just a little bit more sense clinically to the targets listed below. And then lastly, like I mentioned, we're going to start this month distributing PO quarterly reports. They're going to include like practice level comparisons within your PO. So practice 1, 2, 3, 4, you're going to be able to see how they're doing on medications and CGMs, comparison of the PO to the collaborative overall, trending reports on medication prescribing and CGM prescribing, and like your rankings on performance. So like your PO is number 5 of 28 in CGM prescribing, for example. We'll get your feedback on the initial reports and then incorporate requested changes in future reports where it's feasible and makes sense to do so. But you'll be getting those in July, and hopefully those will help both of the upcoming BBR and just for your general awareness and understanding of where your PO and practices are with these initiatives. Any final questions? And I'm sorry to the InHale team for going over time a few minutes. Okay, with that, I'll hand it over to Sean, and we will get out that scorecard to you as soon as we hear back from Blue Cross on if we're good to distribute it. Thanks, everyone.
Thank you, Jackie. We'll give everyone just a couple minutes to transition over if they're going to drop off or not.
Let me know when you want to get started, Sean.
Yeah, Carla, I was just going to say, in the interest of time, we can get going.
All right. Thanks, everybody. Welcome. I hope everybody had a great 4th of July weekend or week. That was actually a while ago, I guess now. And why am I, there we go. So we're going to just do our slide set here, probably do it pretty quickly, hopefully, to make sure that we stay on our time. We've got 20 minutes if we let ourselves go to fully to 12. So we're going to do, here's our agenda. We're going to dive right into things, announcements and updates. Courtney Oliver, our program manager, has resigned her position as program manager with Inhale. She's moving on to a new position within University of Wisconsin, actually. Sean is going to act as our interim program manager while we complete the search for our new program manager. Reminder that to contact me at either Carla@inhalecqi.org or contact@inhalecqi.org. To request resource bags. We can now have our bags that everybody received in the clinic, the collaborative wide meeting. We have those wonderful bags. We'll be able to distribute those out to our practices now also. So they'll have somewhere place to actually store those demo devices and information in. So let me know and or the contact@inhalecqi.org website, email, I'm sorry, to get those ordered for you. Right now we're doing one per practice. Just because it does take a lot for us to get all those resources together. So we also have an open invitation to everyone to join the education work group meetings. You can be PO staff or practice level staff. We meet every other Monday from 4 o'clock to 5 o'clock. And our next meeting is July 24th. Contact information there for Brenna Dressler, who is leading up those meetings at bdressle@med.umich.edu to get the meeting link. Our measures and data hub, our enhancement release 2 is scheduled for July 12th. We've just, they've added the BCN data, which adds about 2,700 patients. And we've finished our testing. And so that will be put into production by July 12th. That's going to add the oral corticosteroid measure. So you'll see that in the MDC data portal. It'll also, as I said, it'll have this updated smoking cessation denominator and then inclusion of the BCN patients. Future dashboard releases enhancements are going to be the specialist attribution in fall and the short-acting beta agonist measure. And then early 2024 will be our maintenance inhaler measure and pulmonary rehabilitation data. We've got some really great news. We were able to work with Blue Cross Blue Shield to get clarification on the inhaler education, as we talked about a lot in the Clinical Champions. We talked about at our collaborative wide meeting. We have clarified with Blue Cross Blue Shield that inhaler education is covered. There was some questions about how to do that and make sure that it gets covered. So when they're billing the 94664, if they're using that code, you need to have a modifier 59 to that in order. It has to go to it has to be attached to the 94664 code and not to the E&M code. But that will make it sure that it's covered. We will be modifying also our measure to reflect that the G coding or the care management coding will also be tracked. We're hoping that with that care management, that the nurses can code for the G codes, that device education obviously would be part of that. That'll be really important that is reflected also in their charting. Portals and websites. We really would love to have your feedback on what you think about our website. We are going to be working on restructuring the resource area potentially. What do you like about it? We do know that we are missing some pieces on there right now. We're working on making sure that we get everything up there. Is there too much, too little? Are there things that you really want to look for? Are there easier ways that you could suggest on finding things? Does it work really well for you? Whatever your feedback is, we'd love to hear it. The administrative portal, hopefully everybody has already heard about this, but they have moved to an updated platform. And you should have received an updated login information. Please let us know if you have not. And then reminding you that hopefully all your practices and providers are already loaded up into our Inhale Learning platform, but contact us again if that has not occurred or if you're having any troubles with that. Reminding you the PCP recruitment is closed. It's all been updated and everybody's in and accepted. All participation agreements should be loaded into the admin portal, that updated admin portal. The next recruitment period is for a specialist. So that's allergy, peds, pulmonary, and pulmonary. That recruitment is going to be opening up in October of 2023 with agreements due to Inhale by December 1st, 2023. And participation VBR for the new practices will start March 1, 2020. Whoop, that should be March 1, 2024. Sorry, that date is incorrect, 2024. Remember that we have a really robust members page on the NHALE website that should detail everything that you need. And we will make sure that those updated like practice agreements and other things or practice requirements are going to be up there once we get that scorecard approved and other things approved by Blue Cross Blue Shield. And we are whipping through this as quickly as we can. It's 11:46. I'm talking really fast. Please, if anybody has any questions, make sure that you, speak up and or post something in the chat. Our regional meeting dates are going to be the 26th of September, the 28th, October 3rd, and October 5th. We have the cities that they'll be in, and I think we're almost completely finalized with locations. We will get that those locations and that update to you as soon as possible. Everybody should have received an email from Kelly spelling that information out for them, and she will keep you up to date on those locations. And our next monthly call dates are going to be August 9th at 2 or August 14th at 11. I do want to say, looking at these dates now, I'm going to be actually out starting October 13th. We will definitely work on, we will have a communication plan and updates to you as soon as we get that totally finalized. So I will be out for a little bit and then be back. So we also want, and this is our last slide, so I think I've gone pretty fast. I apologize for the speed, but hopefully we can actually get you out at 11:50, which is our goal. We are putting together a patient advisory committee development, so I want you to kind of start thinking about that. We're looking, obviously we have 3 populations: pediatric asthma, adult asthma, and COPD. So we're looking at trying to develop a patient advisory committee for that and getting feedback on our education materials and future projects. We also wanted to see if there was anybody that wanted to give any feedback about their collaborative wide. Was it helpful? I got a couple of emails and I really appreciate that, the feedback that we did receive. Any questions, any concerns, any thoughts, anything for future planning? There's a comment from Mark. Our Blue Cross Blue Shield team is finalizing review of the PO scorecard and PCP measures. And that we should have that complete in the next 5 to 7. I got an auto feedback from Courtney when I emailed the general inbox. Oh, just making sure. Okay. Yes, we did get, we are getting the emails. Let me make sure, Gina, that we are, that we will take Courtney off that messaging, and hopefully that will, she was probably just covering every other mode that people are doing. We'll make sure that that's off that contact email. So thank you for that feedback. Anybody else?
And then Carla, Mary Carly posted, still need registration links for the meetings, please. So we will double check and make sure that those were sent and or resend them to you.
The registration links for the regionals probably has not gone out quite as yet. I think that the goal was to have it on Friday, but Kelly was still waiting on a hotel or a conference center for
Rochester.
Yeah, for confirmation on that. So we will work with her today and make sure that that gets out by, I would say Wednesday.
And then one other thing, Ryan Carb is actually on this call, and he also put in the chat. So he is for any portal related matters, he's the developer, and he can be reached directly if there are any issues whatsoever. So we're obviously pairing with MCT2D. They've been gracious enough to let us use their website platform as well. But obviously you can reach out to our team as well if you have any questions or concerns.
Anything else? I think that was super fast. And I apologize for the speed, but again, we want to be really respectful of your time and your fact that you've been sitting down for an hour. So anything else? Sean, can you think of anything else? So Ryan Karpus regarding the admin portal, MDC for the data portal, contact at our contact email. We'll make sure that that is not sending out an away message any longer.
Yep.
And feel free to reach out to any of us at any point in time. And again, really looking for that feedback. So.
Yep.
Megan is on the line here. I don't know, Megan, if you're able to talk. Do you want to say anything more about the Patient Advisory Committee? Sorry, I'm kind of putting you on the spot
sure.
here.
Yeah, we're I'm actually meeting with Dr. Lagogo this week. So just finishing some of our specifics about, how many patients we might be looking for from which regions. And we're just finishing putting some polishing touches, I guess, on some of the materials. So you can feel free, I can put my email in the chat if you have any more questions for me. But we are hoping to have our first meeting probably in September, October, just hoping for no delays on our end with some regulatory items. Thanks, Carla.
Thank you, Megan. And just another plug for people to sign up for our educational meeting. We have a wide range of people on the meeting right now, and it's we've gotten some really great stuff developed and feedback given. So let us know if you're interested. And we will make sure that that registration for the regional meetings is out by Wednesday. And with that, I think,
Great.
Sean, are we okay to go?
Yeah.
And thank you for that. And I hope I didn't go way too fast. And we will be getting, as we said, once we get everything's finalized with Blue Cross Blue Shield, we'll be getting out that extra data about the scorecards and other things. Hopefully we'll have that to you. We will have that to you by the August phone call. Thank you so much for your time, and everybody have a great day and a great week.